Well, I would say that probably every clinic performs the embryo transfer in the way they feel is the best one, okay? In our case, we think that it's really important to make sure that when the embryo leaves the incubator, we are ready to transfer it immediately into the uterus. The catheters are usually designed in a way that they can hold the temperature, which is a very important factor that may damage the embryo if it's not properly kept in the right conditions, for 30 seconds. So we don't want to run the risk of bringing the catheter with the embryo and then start having problems to insert the catheter into the uterus. This is why we have abandoned the mock transfers that we were doing years ago, in which we were performing that kind of mock transfer to the patient just to write down the notes of how the transfer should be done. And why? Because sometimes, even in cases in which the mock transfer was easy, on the day of the embryo transfer, the conditions may have changed and you may have problems to place that catheter inside. So what we usually do is that we first clean the vagina to remove all the vaginal pessaries that the patient may have taken before, and then we take an empty catheter and we place it in the right position. The right position is always at the beginning of the endometrium cavity. And we do that because if we need more time to place and to reach that point, if the catheter is empty and the embryo is at the incubator, we are not in a rush. We don't need to, we are not going to suffer that the embryo may lose quality due to this time that we are going to spend getting into the cavity. Once we are sure in the scan that the tip of the catheter is at the right place, then the embryologist brings the inner part of the catheter where the embryo or the embryos are. And then we are almost sure that in 99% at least of the cases, it's going to take less than 30 seconds from the moment that the embryo leaves the incubator until we place it into the cavity. Once we have done the embryo transfer, the embryologist takes back the catheter to the lab and empties the catheter, just to make sure that there is no embryo left at the catheter. Sometimes when you are transferring blastocysts, and if they are big, expanded blastocysts, it may happen that the fluid goes out, but the embryo whirls inside of the catheter and remains there. And you feel like the transfer has been easy, but the embryo is still on the catheter. This is why it's important to check that the catheter is empty after that. Once the embryologist confirms that the catheter is empty and that the embryos are inside, we insert an extra progesterone pessary and the transfer is done. In normal conditions, it should take no more than 5 to 10 minutes, but in cases, for example, of patients who have had, let's say, a surgery of the cervix, it could be really difficult because there could be scars inside or there could be false ways and the catheter may be harder to place in the right position. But working with an empty catheter, no problem. We can even spend 5, 10, 15 minutes and work until we are sure that we are at the right place.